Good afternoon, drmaas.com. I'm looking your best, and I'm working this week. We did several blepharoplasties and had some post-op blepharoplasty patients that brought up some good questions. Also some consultations that came in that asked me some questions that I hear repeatedly, and I wanted to kind of cover a couple of those. One of them that's common is, which is better for upper eyelid sagging, a brow lift or a blepharoplasty? And there's not a right answer to this. Every patient needs to have their surgeon evaluate their brow position and their eyelid skin redundancy. I will say in general terms that most people that are thinking about their eyelids looking saggy would benefit from blepharoplasty. There are some patients who have had a previous blepharoplasty that would benefit from just browplasty or a browlift surgery. But very few people don't benefit from blepharoplasty that haven't had anything done before. And obviously, and we talk about this often with our patient consultations, to get the optimum result, usually in patients that are in their 40s, 50s, or beyond, they'll benefit from both browplasty and blepharoplasty. The modern browplasty, although there's some controversy about going back to the old ways with the ear-to-ear incision coronal brow lift, or an incision that traverses the frontal hairline, a trichophytic brow lift. For most of us in California, the endoscopic brow lift is the strategy that is easiest to recover from. The technology has made the procedure relatively simple. It can be completed in less than an hour, and there's very little trauma for the patient, so recovery is much, much quicker with browplasty using the endoscopic techniques. Getting back to the original question of who is the right candidate for blepharoplasty versus browplasty, typically we'll take the brow and position it carefully in a very good position and see if there's redundancy of the skin there. If there's redundancy of the skin, a blepharoplasty is indicated in that patient, and then there can be a decision about whether a browplasty would be performed. One of the things about blepharoplasty that makes people particularly attracted to it is that it's a relatively simple procedure that can be performed as an outpatient within an hour or so in the office, and typically has very little recovery time, whereas with browplasty there's more like a week of recovery with swelling of the forehead and typically a little bit more bruising. Both of these procedures, however, can be performed as an outpatient, and a combination of blepharoplasty and brow lift can be expected, upper blepharoplasty and brow lifting can be expected to be completed within a couple hours using the endoscopic technique. So the simple answer to the question is, which is better, is you have to see your surgeon and talk about it. If anybody has a question that would like about this and would like me to look at their image and help them decide which is better, ideally send me a little video clip, or just send me a set of photographs with a picture of you raising your eyebrows and your eyebrows relaxed, and I'll be happy to get back to you with what I think your best options for on drmaas.com. This is drmaas.com. I'm looking your best. Thanks for visiting. Don't forget to visit our website at maasclinic.com.